Good afternoon. My name is Marcus Perry. I'm a social worker here at East Carolina University, Department of Pediatric Hematology Oncology. I'm honored today to be here with Dr. Bing Fu. He is the director of East Carolina University Department of Pediatric Hematology and Oncology. Dr. Fu, thank you for taking the time out today and being with us. We wanted to discuss and kind of target today um, anxieties in regards to COVID 19 and returning to school. With COVID 19 being a new crisis for us in America and also within Eastern North Carolina, many of our patients that we serve, many patients who have sickle cell disease, cancer, and other bleeding disorders are served by our team. And with those conditions, have lots of anxiety regarding returning to school and COVID 19. I'd also like to thank ECU for the opportunity of us being able to be here today. Dr. Fu, thank you for meeting with us. What are the most common symptoms of COVID 19?
Thank you, Marcus, for joining me today as we try to answer some of the questions and allay some of the fears of our parents here in Eastern North Carolina and around the state. As you know, COVID 19 has been with us at least since March. A lot of people think it has been here much further than that, and we have been able to learn quite some about COVID 19. So, COVID 19 has a wide range of symptoms. It can range from no symptoms at all, which happens in a good number of children, to very serious symptoms that can even result in death. Some of the common symptoms of COVID 19 would include fever, we all know about, cough, loss of smell, loss of taste, weakness, muscle pain. There are children, especially who have abdominal pain, nausea, loss of appetite. They may have diarrhea. Some of these children may develop severe respiratory distress that they may end up needing support with their respiration, needing intubation, and being in the intensive care unit. The other symptoms like sore throat that I did not mention, which can happen with COVID 19.
Dr. Fu, are kids really less likely to contract COVID 19 or merely less likely to show symptoms or negative effects?
Thank you, Marcus. Let me just first make it clear that children can contract COVID 19. Children will develop symptoms of COVID 19, and children can develop serious complications, and some of them will die from COVID 19. That being said, we know that children are less likely to develop severe complications from COVID 19 when compared to adults. When we look at the numbers, both here in the United States and around the world, we know that the number of COVID 19 cases in children is lower than it is in adults when you compare to their share of the population. So we have some reason to believe that children may contract COVID 19 at a lower rate than adults. However, there is some concern that these lower numbers we are seeing is because children frequently do not have symptoms from COVID 19. So, since most of the time we test people who have symptoms, we may just be picking up fewer children who have COVID 19 because they don't have symptoms. We will know in the months and perhaps years to come what the real question is when it comes to children and their risk of contracting COVID 19.
Dr. Fu, what else, I guess, is known about COVID 19 in children?
So, one, as I mentioned, we do luckily see less severe complications in children. We know that there are some symptoms which are more common in children than in adults. For example, the complications of belly pain, the complications of diarrhea, loss of appetite, the complication of vomiting. We have in the last few months noticed a very unusual inflammatory symptoms in children. It is also known as a multi-system inflammatory syndrome in children. Some people call it MIS-C. This involves inflammation of the brain, the bowels, the heart, the kidneys, the lungs. These symptoms can last for months, and we are not quite sure what the long-term implications of some of these symptoms are. Initially, we thought it was similar to what we call Kawasaki, but we see that it does affect more organs than we initially thought. This seems to be more common in children and more peculiar to children than adults.
For families in the community, Dr. Fu, how do you determine, as a parent, how do you determine if your child's at higher risk for contracting COVID-19?
First of all, most of the children that we serve in the division of pediatric hematology oncology are considered higher risk. This is based on the immune system being compromised. So if you have a child who has received any form of chemotherapy, that compromises the immune system. So they are certainly going to be at higher risk of contracting COVID-19 and getting more complications. You have a child who was born with problems with their white blood counts, or they have problems with their spleen. These are all parts of the immune system, and that child is at higher risk of contracting COVID-19. And if they do, they're at higher risk of having severe complications. Now, as we mentioned, COVID-19 can affect multiple organs in the body, including the lungs, including the spleen, including the gastrointestinal tract. So you have a child who has, let's say, Crohn's disease, so their bowels is already impacted. In addition, some of the medication that we give to fight Crohn's disease can weaken your immune system. So you have a chronic disease like Crohn's disease, your child has a higher risk with COVID-19. You have a child with asthma, that already weakens their lungs. So you get COVID-19, you are at higher risk of getting severe complications from COVID-19. Same with children who have chronic heart disease, those who were born with heart disease or who have acquired heart disease over their life. Same with children who have chronic kidney disease, as well as some other children who may have rheumatoid arthritis. They all have higher complications from COVID-19 and are considered higher risk.
Dr. Fu, school will be starting here in North Carolina very soon. In Pitt County, school begins on August 17th. How should I decide if my child should attend school this fall?
I think as you look at that very difficult decision, which I think every parent should make, the first consideration is, what is my school putting in place to reduce the risk of disease spread? In North Carolina, the governor and our public health authorities have set out some guidelines to help schools prepare themselves for school reopening. One, talk to your school directly. How are the children going to be cohorted? By cohorting, I mean, how are they going to limit the exposure of one group of children to the other? How are they going to have their lunch? How do they get into their classroom in the morning? If the school has procedures in place which limits contact between children as they get into school while they're in class, that is a good sign that your child's risk will be low. The next consideration is your child. Is your child mature enough to be able to do the physical distancing that is necessary? Will your child be able to wear a mask throughout in school? Is your child able to follow instructions that are given by the teachers? As you realize, it's not just about the age of the child, it's about the maturity of the child. The third component is, who else is in the household? Do you have vulnerable elders in the household? Lastly, is your risk. We are looking at, everybody has a different appetite for risk. What risk are you willing to take for your child? Because we do know that if we open up schools, there's an increased risk to the children, despite all the precautions that we put in place. But education is important enough that every parent will wear this. And luckily for us in North Carolina, the state has given the parents, at least here in Pitt County, the option of choosing to continue virtual education only versus in-person school.
Dr. Fu, North Carolina has extended the phase 2. Recently, the phase 2 restrictions has been extended. With that said, should I change my decision about how my child attends school this fall?
Marcus, as you know, we have unfortunately had significant increases in COVID 19 cases in North Carolina in the past 2 months. So I don't think the extension of the phase two was unexpected. Given the trajectory of cases, we expected that the governor was going to extend phase two. So, no, it doesn't change the calculus at this point. The key is what we have discussed earlier. What has your school put in place? What is your home situation? And what's your level of comfort with the risk that we are discussing?
Dr. Fu, the community spread of the virus here in Pitt County, can you describe where we're at here in Pitt County?
I wish I could tell you that we were in a good place. Unfortunately, Pitt County, like the rest of North Carolina, has seen a rapid rise in the number of COVID 19 cases in the last 2 months. Since the beginning of August, we have ranged somewhere between 7 new cases a day to 42 new cases a day here in Pitt County. So, yes, we have to assume that we are a hotspot and take the precautions as needed. Remember, we are talking about school today, but a lot of spread does not necessarily happen in school. The children that we have seen today with COVID 19 most frequently get it from household members.
If a parent chooses for their child to go to school, what activities should they participate in, or what activities should they maybe not participate in?
I think when we look at school now, the key aspect of school this fall semester is education. Unfortunately, we are going to have to say some of the extracurricular activities are not so much key. So, what are some of the things you should pay attention to? One, contact sports should be avoided because we know that the longer the contact and the closer the individuals are, the higher the risk of contracting COVID 19. So I would say no contact sports. Avoid objects which will change hands frequently between students. So if we can avoid that, people are exchanging laptops or exchanging phones or going to the library and switching computers from one student to the other, try to avoid that. I think school buses are going to be a concern that we need to look at how transportation is done. If the school can make it feasible that children skip rows or you have just one child sitting per row, that would be important. And then avoiding the hallways. Children may have that habit of congregating in the hallway. That is something that we hope schools are going to enforce, and you need to work with your child to make sure that they don't congregate in the hallways, either at the time they're in class or in school or when they're leaving or going to class.
Dr. Fu, based on our clinic, based on children that we serve, the children's treatment and recovery, is it safe for our children who are in treatment to go to school?
If your child was diagnosed with cancer and they have completed all their treatment, so chemotherapy and radiation therapy, and their blood counts are recovered, or if your child has sickle cell disease and they're not currently in the hospital, then the precautions that we just discussed earlier are good, and you should make your decision based on that. So if your school has put the conditions in place and you feel comfortable, your child should be able to return to school if that is your choice. On the other hand, if your child is still in active treatment, they are getting chemotherapy, we want you to contact us and we will discuss the precautions for your individual case.
Dr. Fu, if my child chooses, if they go to school, what are their chances of getting COVID-19?
I think, again, it depends on the circumstance, what the school does. I think we can safely assume that as schools reopen, there are going to be some children who are going to contract COVID-19 in the class. But again, that just as they could contract it in any other circumstance, including at home. So yes, there is a risk that they may get it, but if there is a physical distancing, they are wearing masks and they are avoiding this high risk activity, I think they could safely go to school with a relatively low risk of contracting it. But we cannot keep children 100% from getting it.
If my child contracts COVID-19, what should parents do?
If your child contracts COVID-19, be it at school or somewhere else, the most important thing is to inform the school, keep your child from school, because you send your child to school with concerns for COVID-19, then you put other children at risk. Then you should contact the primary care provider so that we will make decisions on that. If your child is getting treatment and is a patient of ours here at the East Carolina Pediatric Hematology Oncology clinic, call us. We will evaluate your symptoms and we will make decisions on if your child needs to be tested or not. But if they've been tested, they have COVID-19, we will probably watch them very closely at home, and at a point where there are concerns or complications, we may have to bring your child into the hospital for further management.
Dr. Fu, is there anything that I can do as a parent to stay safe while my child attends school?
I think a lot of what is necessary is really in your hands as a parent. I think you can ask the right questions. You can push your school to make sure your school is putting the right practices in place. The public health authorities and the state of North Carolina has worked with the schools to help them develop plans. So you push your school. If you see places where the precautions are not being taken, you call people out, you call other parents out, because we are in this together and we need to call one another out so we can keep one another safe. You start working with your child, teach them the importance of them wearing the mask, of them physical distancing, because that is important for their safety and for the safeties of others around them.
But if parents have other questions as well, specifically around childcare and daycare. If I'm sending my child back to school, should my younger children go to daycare?
I think that is a question that a lot of parents have to grapple with. Especially going to work, you need daycare for your child. I would say for the daycare, take some precautions as we discussed regarding school. What has the daycare put in place to reduce the risk of contact between children, the risk of transmission of COVID-19, and what are the mitigation in place if staff or one of the children catches COVID-19. After evaluating all of that, if you're comfortable with the procedures they have in place, I think you can manage the risk of your child going to daycare and consider sending them to daycare.
Dr. Fu, I'm fidgety myself, and many kids are as well, moving around, staying active. Is it practical to say that a child is able to keep their mask on all day while at school?
It is difficult, but possible. Marcus, I can tell you that as someone who has been treating children with cancer for many, many years now, it's amazing what children are able to learn when both parents and teachers make it clear to them the importance of that measure. So I think what we need to do as parents now is start working with our children. What is important? Why is that important? So we know that the combination of mask and physical distancing is the best tool we have to reduce the spread of COVID-19. Our teachers are going to be making a big effort to keep the children apart. And if we can keep them apart, then if there are phases where they are not so compliant with the mask, then the risk will not be as high as if they were not apart. But it's very important that at least in the times where they cannot stay 6 feet apart from one another, that they wear masks. And I think that's something to take into consideration. How well is your school implementing the rules, and how are they enforcing that children stay a distance from one another and that they wear the mask? One simple trick that most schools should do is arrange the children that when they sit, they face in the same direction, so children are not sitting across from one another, where they increase the risk of spreading COVID-19 to each other.
Dr. Fu, large households, many families have grandparents in their household, elderly people in their household. Is it safe to send my child to school if I have grandparents or elderly people in my home?
You are right to bring up the risk of the elderly family members. We know that the older people are, the higher their risk of severe complications from COVID-19. And that is something you should take into consideration as you decide if your child is going to return to in-person classes or if they're going to stay virtual. Key is that your child follows the rules at school, your child keeps the physical distancing, wear the mask where needed, and avoid close contact with others in their classroom or in the school. If they're able to do this and you have space in your home where they get home, people are doing hand washing and also practicing distancing at home. At home, of course, you cannot do 6 feet apart, but we do need to limit some of our habits of getting into each other's food and randomly kissing one another. I think we can control that risk. But if you feel that your child cannot follow some of the rules and your school is not, you're not confident in the measures put in place by your school, then you may want to consider, for the sake of your elderly family members, keeping your child in virtual education.
If I send my child to school, but then change my mind and would like for my child to receive virtual education, what steps do I need to take?
I think the first thing you should do is talk to your school. Most schools are going to have procedures in place and policies in place regulating how you can change your opinion. If needed, contact us or contact your primary care provider, and we will write a letter of medical necessity which may help you make that change with your school.
Dr. Fu, thank you for meeting with me. I think that there's many families out there that have questions. I hope that we were able to answer their questions to reduce their anxieties and fears. Is there anything else that you would like to add to this conversation?
I want to just add that given my years of experience working with families who have children with severe immune compromise, it's amazing what these families and especially these children, some who are very young, are able to learn and are able to do. Over the years, we've been able to successfully integrate children with leukemia and other cancers into the school system and still continue their treatment and successfully complete their treatment despite all the infections that they are exposed to. So I feel that if the families take it seriously, the children take it seriously, the society takes it seriously, we should be able to successfully get a good majority of our children back in education, be it virtual, be it in person, and still be safe. The other thing I'm very confident about is that we continue to learn more about COVID-19. We already know a lot more today than we did back in March. And as we know more, we are going to be able to handle this condition successfully. And the vaccine will hopefully come along and make our jobs a lot easier. One last thing I wanted to mention is the information we discussed here today, Marcus, is contingent or is based on what we know. There's a good chance that this information will change in the next months as we learn more about COVID-19 and the precautions will have to change.
Thank you very much, Dr. Fu. I appreciate being here with you.
Thank you.